This is Mr. Paul Seligman over at Care Resource. We're hoping that during our time together, he doesn't have an emergency walk-in.
No. But now at this point, the door is closed. The doctors are gone. We are it.
Okay.
Hi, everyone. My name is Paul Seligman. I'm the prep coordinator for Care Resource. I've been here for almost 7 years. It's going to be 7 years. I began working in 2014 in biomedical HIV prevention, which means using a medicine and your own biology to keep HIV out of your body. At first, people used to thought, when I would talk to them, they acted like I had black beans coming out of my mouth. It's like, what are you talking about? Is that science fiction? What is that nonsense? We're giving pre-exposure prophylaxis, which is what PrEP stands for. Have any of you heard about this before? Have any of you raise your hand if you've heard about this before? Okay. Well, everyone knows that PrEP is only for gay guys, right? No. No. And PrEP works on every human body. It's designed to create a chemical barrier inside the body that takes HIV and prevents it from making copies of itself. If it cannot reproduce, if the virus cannot make copies of itself, then there is no way that you can become infected. And the way you become infected is that it enters your lymphatic system, and that usually takes 3 days from the exposure to happen. If I were to show you the numbers, they're astounding. From the moment that an HIV virus gets into the system until it gets into your lymphatic system or your immune system, it takes about 3 days. On the third day of that battle, where one single virus becomes 10 billion copies in 1 day, third day, you're infecting others. That third day, your own immune system says, what's going on here? Send out the tanks. White blood cells come out and look for HIV. They grab it and they bring it into your lymphatic system to study it and create antibodies. And at that point, we can't get it out of your body. You become infected. The hope is, and what we're working towards in terms of the science, is to be able to purge it and clear it of people's body. We're getting closer and closer to this. There have been 3 documented cures, so it's very exciting and optimistic. And part of what happens with HIV is that it's looking for CD4 cells or T cells, and those are your immune soldiers. So every time you've got an infection, all these immune soldiers come rushing in, and they are in clusters there, which create an opportunity for HIV to replicate. That's when it makes copies, when there's lots of opportunity for copies. So what we want is a nice, quiet, stable, calm immune system and no infections. But what we often have is a lot of inflammatory stuff, all the sugar we eat, all the stuff in our food, all the things that we're exposed to in the environment create immune activation, which lead to HIV opportunities for replication. So everyone knows, for example, that with chlamydia, once you've had it, you can't get it again, right? What do you think?
Gonorrhea or chlamydia?
Chlamydia, or gonorrhea too. Gonorrhea, same thing. If you take the antibiotics, it's gone and that never comes back.
I'm going to say no. Never say never.
There's no such thing as an immunity to it. We don't have any way to defend against it except some kind of a barrier like a latex shield, which would be a condom, or just distance. Distance also doesn't, right? But right now, we're dealing with the people are really under the idea that, for example, quickies aren't dangerous and you can't get pregnant with a quickie.
5-second rule, right? Okay.
Wouldn't be here.
Do they know how fast sperm travels?
The truth to the abysmally bad science behind the idea of the 5-second rule. There's no 5-second rule. So if one exposure is all it takes and one contact is all it takes, a lot of people say things to me like, oh, well, you know, he didn't finish, so there's no way that anything can happen. These are the kinds of things that people think about, and they think it's so, and we have to really go out in the community educate a little bit. The most dangerous idea that most of us live with all the time is that this could never happen to me. Me get a STI? No, that would never happen. I'm very clean. Ha, ha, ha. So does this have anything to do with soap and water?
Paul, we are going to be going out into the community and talking about overall wellness, really.
Right.
And you can back me up with the science, but the HIV STI is the comorbidities of gonorrhea.
Really high.
They're all very, very, very high. If you're gonna get one, you most likely are gonna get one of the other.
As a matter of fact,
Yeah.
in just the last 3 consecutive years for Miami-Dade County, and I think all of us are from down here in Miami, 62% of every new HIV infection in Miami-Dade County was a co-infection with syphilis. Syphilis is rampant.
Yep.
Syphilis is epidemic level. Syphilis is so bad that I get calls from the Department of Health asking me if we have penicillin because they ran out. I have hospitals calling us, do you guys have any penicillin left? Because we ran out. Hospitals are running out. So people need big, heavy duty, giant penicillin shots for, they come in and they say, I think I got these sunspots from the pool. Mm-mm. Or I think I touched something funny because I've got this outbreak all over my hands and I think it looks like it should be itching, but it's not. What do you think they have? It's usually syphilis. And we have to also check for HIV. And we're hoping and trying to make people understand right now in this moment where we've got this pandemic going on with COVID, that all it takes for you to become infected with COVID is that you breathe in some random droplet what was in the air where you were walking through. It's not because you're a bad person or you're a bad human being or you were doing something that you're inherently, and that's how we're going to eliminate some of the stigma around HIV. We've been trying to make sure that people understand all it takes to be infected with HIV is contact with someone who's infected and doesn't know it. And the largest majority of the people who are HIV infected have never been tested. They don't know, they're not taking medication for it, and they're the ones who are passing it. That's how 1 out of every 100 new HIV infections in the country is from someone who knows that they're HIV positive. The other 99 are from people who did not know. And doctors also make big mistakes with this. They tell people, oh, you're married, you're in a stable relationship, you don't have to worry about these things. Right. Exactly. The math is working against us because 47% of every new HIV infection is from your primary partner. So what can we do? We can take responsibility for our own well-being, but when you do something like take PrEP, pre-exposure prophylaxis, right now you're taking a pill, it's a daily medication, it creates a chemical barrier that is bioeffective. In other words, effectively able to be used by your CD4 cells. It penetrates the CD4 cells. And this is a little bit of the hypothesis that they had in 2012 when they started and they approved by the FDA and the CDC with Truvada. They had this idea that they had to wait at least 20 days for women for it to reach all their system and permeate all the tissue in the cervix and the uterus and all throughout the vaginal walls. And different than us, they have a lot more layers of tissue there than we do. And that for men, it was 7 days. And that if you were an IV drug user, it was 30 days. And the fact of the matter is that you do not get infected in your rectum or in your vagina. You get infected in your lymphocytes. So well, now, when they released in 2019 Descovy, which is a faster acting, smaller molecule version of Truvada, they started to see that it was bioavailable within 47 minutes of taking the pill.
Oh.
That means it bypassed the kidneys and liver because someone was smart enough to think, we've got this drug that requires filtering and activation by the liver and the kidneys. What would happen if we gave them the pill or a pill that was made from what happened after it was filtered? That's how they came up with the molecules for Descovy. We've got young people working on computers that they create that are being time shared by different labs. And while we're sleeping, that computer is running simulations for some lab doing 20 years worth of research, which is why we're seeing the giant breakthroughs we're seeing in medical science. Travis and I were both at the last biomedical summit that they held in Houston for NMAC, and they were talking about Mosaico. Mosaico is the new vaccine, which looks very promising, and they used the same technology that they used to create that vaccine to create the COVID vaccine that we're all receiving right now. How many of you have been vaccinated against COVID? Raise your hands. Good, I'm glad. Make sure that when it's your turn, it's available to you, that you use it. It's a vaccine. It creates lots of antibodies in your body so that if you come into contact with any form of that virus, you're going to have a response and it's not going to be able to get in. That's the whole point of it. And in that sense, to a certain degree, with PrEP, it works kind of like the vaccine idea. What it creates is a barrier to the chemical use of the protein that it requires to make a copy of its single-strand genetic material. Viruses have RNA. RNA is a single strand, and human beings have DNA, which is a double-stranded helix. So in order for that viral genetic material to interact with ours, it has to make a copy. And what the medicine that we use in PrEP creates a barrier. So when HIV gets into the body, let's say because you've got chlamydia, and that creates immune activation. So there are lots of CD4 cells clustered around. And one single solitary HIV was lingering in there and went, let me get in here. And it attaches to a CD4 cell. Let's say that this hand of mine is a CD4 cell. It goes and makes a copy of itself from that transcriptase protein, and now it has a helix, and it's double, and it can hack right into the nucleus of the cell. It integrates, and at that point, it starts changing this cell, and it makes it into a factory plant of HIV. It makes hundreds of copies. There's nothing left here. It's gone, but hundreds have been made. They've all been released, and they're all going to go and do the same thing. And as I said, that's 10 billion in one day. And 10 billion to the second power on the second day. And 10 billion to the third power on the third day. And so the reason I'm having this conversation with all of you is because this is affecting our young people at an unprecedented rate. And here in South Florida, we continue to lead in the worst possible way as an epicenter of infection. So even during the pandemic, we got to see the HIV numbers go down a little bit, but I think mostly that has to do with the fact that we couldn't do any testing. It's not because people weren't getting infected. And the STI numbers continue to increase, 10% every year since 2018. And when you get chlamydia, your chances of becoming HIV positive have just increased by 20%. Just living in South Florida, your chances of HIV infection have been increased by 10%. Speaking Spanish have increased by 10%. Having brown skin increased by 10%. 1 of every 5 new HIV infections in Miami-Dade County is a woman. 1 of every 5 new HIV infections in Miami-Dade County is a straight guy. People think, oh, this has nothing to do with me. Wrong. The virus doesn't care, and this is what we're seeing with COVID. Everyone thought, oh, it's only going to affect senior citizens. No, it's killing young people as well. And I met my first patient last week who had it twice, had spent 3 weeks in May on a respirator in New York City, and then 2 weeks in September with a variant. So this is how a virus works. Viruses don't care how old you are. They don't care how fat you are. They don't care how much education you have, what kind of car you drive. They don't care if you're wrinkled or if you're smooth, if you're circumcised or not, if you're fat or a virgin. They don't care. It's not important to them. So if you're going to be thinking that HIV is only for certain kinds of people and HIV prevention is only something that certain kinds of people need to know about, we need to break that up. We need to break that up. And in terms of the medicine, there's another strategy we can use, which is post-exposure prophylaxis. Let's say you are in a situation or you have a friend who calls you and said, listen, this happened to me. I went somewhere, they gave me something to drink, and then there was a message on my phone, and what I saw on the phone, I did not like. And I don't know what to do. So they need to get to an urgent care center. They need to get to an ER, because as I said, 72 hours is when it goes into the lymphatic system. And at that point, right now, at this point, we don't have any way of getting it out of your lymph system yet. We will. This is coming. They're working on things. And the Mosaico vaccine is going to be something we're going to be able to use. But for now, if it gets into your lymphatic system, you've been infected. And what we have to do is make sure that you get treatment and remain undetectable. And so the whole idea in terms of the medical point of view is, if we get everyone who's at risk of HIV infections, which is who? Anybody who's sexually active, yes. And we get them on preventive medication. And then we take everybody who is HIV positive and we get them on virally suppressed and on medication and adherence. No entry point here, no entry point here, end of story. In a nutshell, in the simplest way, right now, the CDC has a campaign they call U equals U. And that means undetectable, which is what happens when you are virally suppressed. That means that you're taking medicine that is keeping the virus count in your blood so low that it can't be found. At that point, your ability to transmit HIV through sex has been reduced to a quantifiable next to zero. And when they did a study on this, there was a study that was done in London, and they had a lot of people, a lot of couples who were magnetic. The person who was positive had been undetectable for at least 6 months before the study began. The person who was negative was not on PrEP or using condoms. They were together, they were having sex. There were,
I think it was like 5,000 participants, 5,000 couples.
5,000 couples, and they had 185,000 incidents of sex, and they had 11 transmissions, and 8 of those transmissions were not from their partner, because when we study the virus, we see that it has a phenotype, and you can't get someone else's phenotype from your spouse. Nope, can't be done. So that means that there were 3 transmissions out of all that sex in all those people. So this is why we say U equals U, and that means undetectable is untransmissible. And that's why we call it treatment as prevention. So for the people who are HIV positive, we want to make sure that they are getting treated, seeing their doctors, and staying well. The moment that they don't have that viral activity going on, we're safeguarding their brain, we're safeguarding their health, we're safeguarding their future. One of the things that's been a great joy to me are these last 7 years, where I've been able to keep over 3,000 patients on PrEP. In the whole time, I have a handful, that's 5, who have seroconverted, and mostly it was because they decided to discontinue taking it because they were in love. So if you can have conversations with your partner, then you're safe. If you can't have conversations with your partner about, oh my God, I'm living in Miami and everyone around me is beautiful and everyone around me is saying, well, yes. And sometimes you have to just say, no, also yes, no. Say, no, thank you. No, thank you. Sometimes you're going to say, yes, we're just human, but knowing that you're just human and that they're just human, be able to talk about this. And if you need it, Post-exposure prophylaxis is 28 days worth of a full arsenal of antiretrovirals, and it prevents HIV infections by interrupting the cascade, keeping it from entering your lymphatic system. You have to start it within 72 hours of the exposure. And this is something that's very important for us to talk to our friends about, talk to our coworkers about, make sure the community knows about this. So you've got 72 hours to keep an HIV infection from occurring. And if you think you've been exposed, you're in danger, and you know that when you've been in danger. So when you've been in danger or something happened and you need to interrupt this or keep this from happening, you have to get to an emergency care center, an urgent care center, a clinic like ours, your doctor, and they're going to know what to do. And if they don't know what to do, have them call me.
No, you
Because
need
that's
to
the other thing.
kind of
I get doctors who don't know what they're doing. So they call me. They call me.
What do
And
they
I
tell their
tell,
doctors if they go to see their doctor? Like, what do they
I
say?
think I was exposed in a way that I could become infected with HIV. What should I do? Not only that, I think I was also exposed to something that may be an infection, and I think I need to be tested.
Yep.
That's all it comes down to. And the doctor is not, most doctors are trained sufficiently in the basics of this to understand that they don't need to be squeamish about talking about sex. And most of us don't talk about sex. Women and men are very different in the practice of this. Women talk to each other, and they get cumulative information. We, as men, have been trained to, And so what happens then is we don't have access to each other's knowledge. We don't share it. And then we think that we broke it the first time something happens. And we think that, oh my God, I'm going to go to hell and I'll never have children and I've ruined it. Uh-oh. And no, when a girl has something happen down there the first time, she goes running to her best friend and says, guess what happened to me? And it's a completely different culture. So for us, we need to actually break that up. And in dealing with, for those of us who are dealing in the medical profession or around it and all coordinating services, et cetera, we have to allow that women have a very different process for making decisions. With guys, it's really simple. I tell them, it's new, it's shiny. And they say, okay, I want it. That's not how it works with girls. Because one of the things that happens for the men who sleep with men is that they are conscious of death during sex at least once every 10 seconds. This doesn't happen to heterosexuals. Heterosexuals don't think, I'm going to die from this every time they're having sex. Women don't think, this is going to kill me. They think, oh, I'm going to end up pregnant. They don't think this could kill me. So we have to really disentangle the conversation of death and sex. And that's part of the taboo, part of the stigma, is that we have entangled these conversations and we can't untangle them. Sex is perfectly natural. Sex is an expression of who you are as a human being. Sex is required for your validation. You need contact and touch. Why has this COVID lockdown been so hard on us? No one gives you a hug. No one gives you a back rub. No one pats you on the back. No one gives you a kiss on the cheek. It's hard. This is hard. We're social creatures. So we're social creatures. We're sexual creatures. And that's why PrEP is a great strategy. I have a very simple campaign that I created some years ago. I love it. A pill a day keeps HIV away. Super simple. It's medically accurate in that the most basic way and simple way to take PrEP is every day. When you take it every day, we know that it maintains the chemical barrier and that it's most effective. It's 99.4% effective with Truvada, 99.7% effective with Descovy, and I'm gonna give you a little secret. They're already trying, they're doing human trials on not an intramuscular, but a subcutaneous injection that lasts 3 months. So far, it surpasses everything that they've done with this, and 99.7 is pretty close to perfect.
That's one shot in the stomach, right?
Yeah, that's what's coming.
Yeah.
That's what's coming. So by then, I decided I'm going to get a dart gun.
That can't be our official ending the HIV epidemic policy, but it's a really good idea.
I think people might object. Oh well.
Oh well. If we save your life, then you can file a complaint.
Honestly, the fact is that the future is coming. The future is coming. And for quite a few of you, a future is coming where HIV is in our rearview mirror. And there'll be a whole batch of kids born that are going to grow up in a world where AIDS is history. And this is very exciting. And this is kind of the vision that I want to leave you with. If we use the tools that we have, that treatment is prevention for the people who are positive. To get them into treatment, they need to have testing. Make sure that everyone around you normalizes and routinizes HIV testing. 2, if the people who are at risk of HIV infection, which means they're sexually active in a hot zone like Miami, they take a preventive strategy like PrEP, whether it's in pill form or the ring, which is going to be like the Nuvo ring, or an injection once in every 3 months. And they talk to their doctors frankly about the fact that, yeah, doctor, I am sexually active and I'm in Miami where everyone is gorgeous and everyone is showing skin and everyone is smiling and the girls have their makeup on. It's not like other cities that are sad. We're in Miami where we have a lot of sex tourism. We have a lot of prostitution. We have a lot of hobby prostitutes, people who think, oh, I'll just do this on the side. And you don't have to be promiscuous or a prostitute to be at risk for HIV infections. You can just be with someone who lied to you. That's all it takes. It's a virus. Viruses don't care. Viruses are really just, they're looking for an opportunity and they have the exact same biological drive as you and me, which is make more. So if we use the tools that we have at hand, we close the door on the infection cycle, we end the epidemic, and we're in a new era. Then the science can actually, and the resources can be utilized to actually focus and concentrate on creating vaccines like what they're working on, which is called Mosaico, which is the first really exciting looking vaccine trial. And we can keep on doing the work they're doing based on the 3 cures that we had. They're working on how to give people who are HIV positive a thymus gland infusion that will create CD4 cells or T cells that don't permit HIV in, and they will knock it out. It'll get cleared out of your system. You'll be left virus-free. People who are virus-free are effectively cured.
Okay, we're at 10 minutes, and before we go into Q&A, I want to re-emphasize that your bank of knowledge, first of all, biomedically, is great to hear as we are learning all these things, because we know that the science is there. And the reason that we have the ending the HIV epidemic happening within the timeline by the year 2030 is because we know that with the vaccine trials that are going to be starting over the next 5 years, we will be there in 9 years. But one very important key factor, something that Paul and I learned at the biomedical conference a year and a half ago in Texas, was the science can be there and the doctors can have the pills you need, but it's the community that needs to want it. So as we're going out into the community, and it's the community who knows the community, you don't need CDC telling the community what to do, how to do it, because that ain't going to work, hasn't worked yet, somewhat, but not fully. So we're filling in the gap. We're filling in the gap by us being the community, telling others in our community what's possible, re-educating them on science 101, on math 101, history 101. But in a way that's going to save your life and keep you safe and allow you to be a stronger, more empowered, resilient you. Every single one of us is going to have a manual, because we're going to want to know those resources, and they will come off the tip of our tongues just as fast as they do Paul's. And those numbers that are in your head, how does he know those percentages and that science? Because we talk about it all day, every day. And it will, over time, become second nature for those of you who are just learning about HIV.
And it doesn't matter if you don't know the numbers. It's not
Right.
even about the numbers. That part of it is just my weird little brain doing it in my way. Everyone can talk about it in their own way.
Right.
And the critical piece about it is just giving people the space to understand that we're sex positive. We are pro-sex. It's not against sex. We're not going to tell people stop having sex.
Right.
Have sex. Have great sex. Have better sex. Have connected sex. Have the kind of sex that makes you sing the next day. La 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 la. That's the kind of sex you should be having. That's the kind of sex that you should have. But to do that, you have to have a sense of certainty and confidence, and that means that you're taking good care of yourself.
It says it on the bottle. Drink responsibly.
Yes.
But have sex responsibly.
Yes, also. Absolutely.
Make sure you are okay.
And that you like who you're doing it with sufficiently, and that they like you sufficiently, that you're exalted by it, not degraded by it. That's something. And so we can talk a lot about HIV prevention, but there are things that are underneath it all that are what drives all the problems. So we also have to address all the stuff that's problematic. And that means that for a lot of us, we have a lot of learned self-doubt and learned self-hatred, which we mask with bravado. So when most people are faced with something as real as a conversation about HIV prevention, and trust me, you want to ask someone before you get naked questions about this stuff before you get naked, because having oozing parts and hurting parts afterwards is not fun or sexy. So you have these conversations when you have your clothes on, before you've gotten together, before you've done anything. And you ask them, have you had testing? When was the last time you went to the doctor? What do you think about this? About should we use this or do you use that? How do you prevent conception? How do you prevent infection? What are the things that you do? And make sure that you're dealing with someone on the same level and on the same wavelength. If you want to be the one who's the author of your life, take the steps to be responsible and confident, and that requires some adult decision making. And that's what we got to be leaders about in our community. These conversations are important, which is why you're here. You could be anywhere else. You could be doing anything else. And so I really want to thank you for your time and for your effort. Thank you.
Thank you, Paul, for that, for all of that information. Your knowledge was, I think, received, Paul. Absolutely. Good. There is no more 5-second rule anywhere.
No.
All right. Thank you, Paul. Love
Bye.
you.
Love you.
Thank you for
Bye.
everything, Paul. Have a great day.